So yes, the people are the most important part of Hopkins. You, every one of you, are the people that made it great and made it stand for 125 years. We have an enormous impact at Hopkins, enormous. And it's because of people at every level. Of course, we think about the research and the researchers and the students who do the research here, and they have an enormous impact with their research. They discover molecules and pathways that lead to new discoveries to treat patients. But they don't work alone. They work in labs that need staff to clean up, that need staff just to support their needs and to support what they do. And we all work in teams. And without that team, the researchers could not accomplish their goals. We treat patients. And as you know, we treat them very well. We heard that. But again, it takes that team of people, all of you here, working together to treat those patients. And finally, I think one of the wonderful things we do is make the future the way it is now by teaching the future researchers, the future clinicians, the future nurses, the future staff who will follow in our footsteps. So for all of the teams and all of the things you do, I want to thank you. I've been here a long time myself, and I have been the beneficiary of many, many people contributing to my career, my health, my family. And this is a wonderful place, and the people make it wonderful. And so the people are really one of our most important pillars in our strategic plan. And our strategic plan is meant to keep us focused on the future, to make sure that we can be as great in the future as we are now. And all of you know we're facing a lot of challenges. We're facing challenges in healthcare reform, in the reimbursement, in the demands of medicine and science. Everything is getting harder. And so to pay back to you, the people, the people pillar is going to, part of it that's important to me is to invest in our people, to enhance our culture, to make it the respectful culture and inclusive culture that we know we need to treat our patients in the best way, to teach our students in the best way, and to do the kind of research and care that we do the best. We need to engage every one of our people in what we do. Everyone has to feel a part of that team. Otherwise, we don't do things well, we don't do things the safest way, and we don't have that team that works together. So we are here as part of this strategic plan to promote every career here. We want everyone at Hopkins to realize their professional goals. And then finally, one of the very important goals is to create pathways to advance and reward our most important clinicians at every level. When you think of a clinician, sometimes you think of just the physician. But a clinician means many, many people. Everyone who touches a patient, our nurses, our staff, our people who are engaged in clinical care. We're here to make sure that they are advanced and rewarded and remain at Johns Hopkins to continue to make us great. So I want to thank all of you for everything you do, because everything you do contributes to the success of Johns Hopkins and the future. So thank you.